Thank you very much, Mr. Chairman. Dr. Stone, Dr. Kim, welcome, and I appreciate you being here with us today. I want to start on the topic of how we promote vaccine confidence and fight disinformation and misinformation that can lead to vaccine hesitancy. We are seeing misinformation about vaccines spread really easily and widely across the internet, including through social media and messaging apps, coming from all kinds of sources and targeted to all kinds of people. And a lot of discussion around disinformation has been around communities of color. But we know that disinformation is a serious concern among all demographics. That can lead to our veterans, caregivers, family members refusing a vaccine even when they are offered one. So I wanted to ask you, how is the VA and its federal partners tackling this disinformation targeting all groups of veterans?
Senator, thank you. In my opening statement, I discussed the fact that we're very proud of the fact that we are not seeing in communities of color a vaccine hesitancy resulting in disparities. What we are seeing, however, in rural America is much more hesitancy to take this, and therefore we've had a very active campaign to communicate, especially with our primary care providers, recognizing the fact that the most trusted person is your doctor or your care team in really dispelling the problems of vaccine hesitancy. And I'm going to defer to Dr. Kim, who's been close to this effort.
Sure, thank you. Senator, we've thought a lot about this issue ever since the fall when we knew these COVID vaccines would become available, and thought about how to get information out to our veterans that was science-based. We did focus groups with our veterans, especially those of color, to find out what they needed to know to help them make a decision if they were hesitant. And they told us they wanted the science. They wanted to know if a vaccine was safe and if it was effective. And they, as Dr. Stone said, wanted to talk to someone they trusted on their healthcare team. So we combined all of that and have been working with CDC, who has a Vaccinate with Confidence campaign, to get science-based information on the vaccines in the hands of our clinicians so they could have conversations with their veteran. There really is no substitute for the hard work of calling somebody and having a conversation with them, and it is 100% worth it. When you can talk to one person and they figure out that they do want to get vaccinated, they tell their family, they tell other veterans, they tell their coworkers. And so there's no substitute for that hard work, and we prepared our staff in VA for those conversations, and I've heard many stories from around VA about how clinicians are getting on the phone, talking with their veteran, helping them make those decisions.
Well, thank you for that. And as we know, COVID-19 has had a disparate impact on communities of color. We know there's been a history of racism and medical mistreatment of people of color in this country. And those inequities have made the COVID crisis even more damaging for communities of color and made it critical we do not let systemic racism block people of color from getting vaccinated. I was really glad to hear that the VA has been working with communities of color to answer questions about any questions they have about vaccines. But even when those questions are answered, there are still barriers to access. And often these facilities are not located in the same community, which may force veterans to take time off from work or find childcare or find transportation to reach a VA facility where the vaccine is offered. So what is the VA doing to build trust within these communities and address those barriers to access?
Senator, I'm going to defer to our regional leaders, Dr. Patterson, because you've done a very aggressive outreach to these populations. And Dr. Patterson, if you could also discuss just about the relative access of your veteran population, and then if Mr. Gelati, if you could follow that.
Right. Thank you for the question, Senator. If you look at Vision 15, and we cover the states of Kansas, Missouri, Southern Illinois, some of Southern Indiana, a little bit of Northwest Arkansas, Northeast Arkansas, and Northwest Kentucky. Within that area, overall, 95% of our veterans live within 60 minutes of a VA facility, whether it be a clinic or a hospital. Now, that tells you one story for an entire 6-state area. However, if you look at individual areas within there, most of our medical centers follow that same pattern. Some of them, for instance, Wichita, only has 73% who live within the C box in the rural areas that are within 60 minutes. And some are all rural and have a lot more contact. However, when you also talk about the way that our hospitals reach out to every ethnic group in order to get vaccinated, when we look at the large cities, St. Louis, Kansas City, even Wichita, our medical centers are located in the Black communities. And so while Kansas City talks about a vaccine desert because there are no hospitals within a mile to 5 miles of the Black communities, ours is in the middle of it. And so we're not seeing the equity problem with vaccination because physically we are close enough to the community for people to get there and to get vaccinated. With our clinics,
Okay.
particularly in our metropolitan areas, which
And
will reach.
I'm over time. So, Mr. Chairman, in respect to you, I have a few other questions that I'd like to submit, and I want to make sure we continue to watch this very carefully.
Absolutely. Thank you, Senator.